Okay, so it looks like you're prepping for a pretty big medicine exam.
Yeah.
And you've sent over what looks like a mountain of notes,
Mm.
articles,
Mm.
and even some past papers. I'm feeling stressed just looking at it.
Yeah, a lot of students are going through that right now. So.
Right. But that's why we're here.
Yeah.
We'll break this mountain down into manageable chunks,
Right.
focusing on the absolute must-knows to help you ace that exam.
And what's fascinating about this material is that it really does cover such a huge spectrum of medical knowledge. It's like a greatest hits of gastrointestinal conditions, kidney function, and everything in between.
So where do we even begin?
Your notes start off with a deep dive into gastrointestinal diseases.
Okay.
Peptic ulcers are first up.
Ah, peptic ulcers. Now I remember those from med school. Always thought stress and spicy food were the main culprits.
Right.
But then we learned about this bacteria called Helicobacter pylori.
That's right. It turns out that H. pylori plays a crucial role in the development of most peptic ulcers.
Oh, wow.
Imagine this tiny spiral-shaped bacteria
Yeah.
burrowing into the stomach lining, creating those painful sores.
So it's not just about avoiding stress and chili peppers anymore.
Not quite. While lifestyle factors can contribute,
Right.
the real focus now is on eradicating H. pylori.
Okay, and how do we even know if someone has this bacterial infection?
Well, there's a clever test called the 13C urea breath test.
Oh, okay. This sounds like something out of a science fiction movie.
It's actually pretty straightforward.
Okay.
The patient swallows a capsule containing urea labeled with a special carbon isotope.
Mm-hmm.
If H. pylori is present, it breaks down the urea,
Okay.
releasing carbon dioxide that can be detected in the breath. It's like a mini science experiment happening inside you.
Pretty cool. Okay, so let's say we confirm the H. pylori infection. What's the treatment plan?
The mainstay of treatment is a combination of antibiotics to kill the bacteria and proton pump inhibitors, or PPIs, which reduce acid production in the stomach, giving the ulcers a chance to heal.
Got it. And I'm guessing surgery is a last resort.
Exactly. Surgery is typically reserved for complications like bleeding or perforation, which thankfully are relatively uncommon these days with effective medical treatment.
So moving on from ulcers, we come to inflammatory bowel diseases.
Okay.
Specifically Crohn's disease and ulcerative colitis. These two always seem to trip students up.
They can be tricky to differentiate.
Yeah.
But understanding the location and pattern of inflammation is key.
Okay.
Crohn's disease can affect any part of the GI tract from mouth to anus.
Wow.
And it involves transmural inflammation, meaning it affects the entire thickness of the bowel wall. Think of it as inflammation going all the way through like a tunnel.
Got it. So Crohn's is like a tunnel of inflammation through the bowel. What about ulcerative colitis? Where does it strike and what does it look like?
Ulcerative colitis, on the other hand, is limited to the colon and rectum.
Okay.
And the inflammation is superficial, affecting only the inner lining, the mucosa. Think of it as more like a surface wound on the colon's lining.
Okay, that helps a lot. The notes also mention extratestinal manifestations. What in the world does that mean?
Those are symptoms that occur outside the GI tract,
Okay.
which is what can make IBD so complex.
Right.
Both Crohn's and UC can affect other organs, including the eyes, skin, and joints. For example, you might see eye inflammation like uveitis skin lesions, like erythema nodosum, or joint pain and swelling like arthritis.
Oh, wow. So even though they're primarily bowel diseases, they can have far-reaching effects.
They can.
What about irritable bowel syndrome, or IBS? My notes say it's a diagnosis of exclusion. What does that mean?
It means that we diagnose IBS by ruling out other conditions.
Right.
If someone has abdominal pain, bloating, and changes in bowel habits, and all other potential causes have been excluded through tests, then we consider IBS.
So it's kind of a last man standing situation.
Precisely. And that's why it's so important to look for red flags that would point towards other conditions. For instance, blood in the stool, unintentional weight loss, or fever could indicate something more serious.
Okay, so ruling out those red flags is essential. What about treatment for IBS? Is there a magic pill for this one?
Unfortunately, no magic pill exists.
Oh, bummer.
Managing IBS is often about lifestyle changes.
Like what kinds of changes?
Well, diet modification is key. Identifying trigger foods and eliminating them can make a world of difference.
Right.
Stress management is also crucial, as stress can exacerbate IBS symptoms.
Okay.
And of course, regular exercise can help regulate bowel function and reduce stress.
So it's a holistic approach focusing on the mind-body connection.
Exactly. It's not just about treating the symptoms, it's about understanding the underlying triggers and finding ways to manage them.
Right.
Some medications can help with specific symptoms, but there's no one-size-fits-all solution.
Makes sense. Now let's move on to malabsorption syndromes.
Okay.
Celiac disease and tropical sprue are on the list. Two conditions that often get confused.
It can be tricky. Both involve damage to the small intestine, leading to malabsorption of nutrients. But the causes are quite different.
Okay.
Celiac disease is an autoimmune reaction to gluten, a protein found in wheat, barley, and rye.
Got it.
So if someone with celiac disease eats gluten, their immune system attacks the lining of their small intestine, causing damage.
So it's like gluten is the enemy for people with celiac disease. What about tropical sprue? What triggers that?
Tropical sprue is thought to be caused by an unknown organism, possibly a bacteria or a virus.
Interesting.
And as its name suggests, it occurs mainly in tropical regions.
Makes sense. So both mess up your gut, but for different reasons. The notes mention an intriguing rash linked to celiac disease, dermatitis herpetiformis. Now that's a mouthful.
It is. And it's not just a name, it's actually quite distinctive.
Okay.
Imagine intensely itchy blisters that erupt symmetrically on the elbows, knees, buttocks, and scalp.
Wow. That's a visual I won't forget. So if you see that rash, think celiac disease. Okay, next up is Zollinger-Ellison syndrome. It's a rare one, but apparently a favorite on exams. What's the deal with this one?
This one's all about gastrinomas, which are tumors that secrete gastrin, a hormone that stimulates acid production in the stomach.
Right.
The excessive acid leads to peptic ulcers and other complications.
So instead of H. pylori causing the acid problem, it's a tumor gone rogue. And I'm guessing PPIs are the go-to treatment here as well.
You got it. PPIs are used to try and control the excessive acid production. Surgery to remove the tumor is sometimes possible, but it depends on the location and spread.
Okay, moving on to something we've all experienced, heartburn. That brings us to GERD, or gastroesophageal reflux disease. What's the mechanism behind this burning sensation?
Imagine this. The lower esophageal sphincter, a muscular valve that separates the esophagus from the stomach, is like a gatekeeper. In GERD, this gatekeeper malfunctions, allowing stomach acid to splash back up into the esophagus.
Ouch. So it's like acid taking the wrong turn and irritating the esophagus. The notes emphasize complications like esophageal strictures and Barrett's esophagus. Those sound serious.
They are. Chronic acid exposure can lead to scarring and narrowing of the esophagus, making it difficult to swallow. This is called an esophageal stricture. Barrett's esophagus is even more concerning. It's a precancerous condition. Where the cells lining the esophagus change, increasing the risk of esophageal cancer.
That's a scary thought. So controlling that acid reflux is crucial. What about constipation? The notes go deep into different types of laxatives. What's the scoop on those?
There are several types, each working in a different way.
Okay.
Bulk-forming laxatives like psyllium add fiber to the stool, making it easier to pass.
Okay.
Osmotic laxatives like lactulose draw water into the colon, softening the stool.
Got it.
And stimulant laxatives like bisacadil stimulate intestinal contractions to move things along.
So it's about choosing the right tool for the job, depending on the cause and severity of constipation. What about gastrointestinal bleeding? The notes specifically mention upper GI bleeding.
Upper GI bleeding is often dramatic and scary, with vomiting blood or passing black Tory stools.
Oh, yikes.
The initial focus is on stabilizing the patient, gaining IV access,
Right.
providing blood transfusions if necessary,
Okay.
and identifying the source of the bleed.
Right. Sounds intense. What are the common causes of this type of bleeding?
Peptic ulcers are a major cause, as are esophageal varices.
Got it.
Varices are dilated veins in the esophagus
Okay.
that can rupture and bleed profusely,
Wow.
especially in people with liver cirrhosis.
Okay, last one on the gastrointestinal list. Hirschsprung's disease. This one sounds pretty rare. What's the key takeaway here?
Hirschsprung's disease is a congenital condition where there's a lack of nerve cells in a portion of the colon, leading to bowel obstruction. The classic finding is an empty rectum on exam, which is a helpful clinical pearl to remember.
Got it. Empty rectum. Think Hirschsprung's. Now let's shift gears and dive into kidney and urinary tract diseases. The notes start with acute kidney injury, or AKI.
Think of AKI as the kidneys suddenly going on strike.
Okay.
It can be caused by a variety of factors,
Right.
but we can break them down into three main types: prerenal, renal, and postrenal.
Okay, break that down for me. What do those fancy terms actually mean?
Prerenal AKI is like a pump failure. There's not enough blood flow to the kidneys, often due to low blood pressure or dehydration.
Okay.
Renal AKI is like damage to the filters themselves.
Okay.
The nephron's often caused by medications, infections, or autoimmune diseases.
Right.
And postrenal AKI is like a kinked hose. There's an obstruction somewhere downstream,
Oh, wow.
preventing urine from flowing out, and this back pressure damages the kidneys.
Those analogies really paint a clear picture. So it's all about figuring out where in the system the problem lies. What about glomerulonephritis, those tiny filters in the kidneys getting inflamed? Right.
Exactly. It's often characterized by the classic triad of hematuria, blood in the urine, proteinuria, protein in the urine, and hypertension, high blood pressure.
Sounds like a triple whammy. What causes this inflammation in the first place?
There are many potential culprits, including infections, autoimmune diseases, and certain medications.
Right.
Post-streptococcal glomerulonephritis, triggered by a strep throat infection, is a common cause, especially in children.
Okay, next on the kidney list is chronic kidney disease, or CKD. This one sounds like a slow burn compared to the sudden strike of AKI.
That's a good way to put it.
Yeah.
CKD is like a slow-burning fire in the kidneys,
Okay.
a progressive loss of kidney function over time.
And what are the usual suspects behind CKD?
The most common culprits are diabetes and hypertension.
Okay.
These conditions, if not well managed, can damage the delicate blood vessels in the kidneys, leading to CKD.
So it's all about managing those underlying conditions to prevent or slow down the progression. Right.
Absolutely. Early detection and treatment of diabetes and hypertension are key to protecting those precious kidneys.
Okay, on to something we're all familiar with.
Yeah.
Urinary tract infections, or UTIs. Everyone's had one at some point, right?
UTIs are incredibly common, especially in women.
Right.
And it's important to distinguish between cystitis, an infection of the bladder,
Got it.
and pyelonephritis, a more serious infection of the kidneys.
Okay, so cystitis is like a bladder bug, and pyelonephritis is when the infection climbs up to the kidneys.
Yeah.
Not good.
Exactly. Cystitis usually causes pain and burning with urination frequency and urgency.
Right.
Pyelonephritis can cause fever chills, flank pain, and nausea, in addition to urinary symptoms.
Wow, okay. Moving on to electrolytes. The notes mention hyponatremia, hyperkalemia, and hypercalcemia. These always make my head spin.
Electrolyte imbalances can be tricky, but they're essential to understand.
Right.
Because they can have significant effects on various organ systems.
Right.
Hyponatremia means low sodium levels.
Oh, there.
Hyperkalemia means high potassium levels. And hypercalcemia means high calcium levels.
Right, so low sodium, high potassium, high calcium. Got it. The notes also mention genetic counseling, particularly for kidney diseases, like polycystic kidney disease, or PKD.
PKD is a genetic disorder where cysts form in the kidneys,
Okay.
leading to progressive kidney damage.
Right.
Genetic testing can confirm the diagnosis.
Okay.
And has implications for family members who may also be at risk.
Right.
It's important for individuals with PKD to discuss family planning and the possibility of passing on the gene with a genetic counselor.
Okay, we've covered a lot of ground on gastrointestinal and kidney conditions. Maybe we should take a breather.
Yeah.
And then delve into the rest of your notes.
That's a great idea.
Okay, we're ready to tackle the next section. It's like we're diving into some challenging topics, poisoning, rheumatoid arthritis, and more.
All right, bring it on.
Okay, my notes start with organophosphate poisoning. What exactly are organophosphates and why are they so dangerous?
Organophosphates are chemicals found in insecticides and nerve agents. They're highly toxic because they inhibit cholinesterase, an enzyme that's crucial for nerve function.
So they mess up how our nerves communicate.
Precisely. This leads to a whole cascade of symptoms, both muscarinic and nicotinic.
Okay.
We're talking excessive sweating, salivation, pinpoint pupils, muscle twitching weakness. In severe cases, it can even lead to paralysis and respiratory failure.
That sounds terrifying. The notes mention a drug called pralidoxim as an antidote. How does that work?
Pralidoxim is a cholinesterase reactivator. Think of it like rescuing the enzyme from the clutches of the poison.
Okay.
It works by removing the organophosphate molecule from cholinesterase,
Okay.
allowing the enzyme to function again.
Ah, so it's like a molecular rescue mission.
Right.
But what happens if someone is repeatedly exposed to these chemicals?
That's where it gets really concerning.
Okay.
Chronic exposure can lead to something called organophosphate-induced delayed polyneuropathy.
Wow, that's a mouthful.
Which can cause long-term nerve damage, weakness, and sensory problems.
Okay, so prevention is key here. Let's move on to another type of poisoning, arsenic. It seems like something out of a mystery novel, but it's a real danger. What are the signs and symptoms?
Arsenic poisoning can be pretty subtle at first, but it can quickly escalate. Early on, you might see gastrointestinal symptoms like vomiting, abdominal pain, and a distinctive rice-watery diarrhea. There can also be a garlicky odor on the breath, which is a bit of a giveaway.
Wait, so garlicky breath could be a sign of arsenic poisoning? Seriously?
It might sound strange, but yes. As the poisoning progresses, you might also see skin changes like hyperpigmentation and a raindrop appearance.
Raindrop pigmentation, that's a new one. My notes also mention a milk and roses complexion. That sounds almost poetic for such a serious condition.
It does, but it's a bit of a misnomer. It actually refers to vasodilation, the widening of blood vessels causing a flush appearance, but arsenic poisoning is far from poetic. It can lead to multi-organ failure and death if not treated promptly.
Okay, so early recognition and treatment are vital. What's the antidote for arsenic poisoning?
The go-to treatment is a chelating agent called dimercaprol, or BAL. It binds to arsenic and helps remove it from the body.
Got it. BAL for arsenic. What about lead poisoning? That's another heavy metal with a bad reputation.
Lead poisoning is a serious concern, especially in children. It can affect pretty much every organ system. But the brain, nervous system, blood, and kidneys are particularly vulnerable. Symptoms can be quite diverse, including developmental delays, learning difficulties, abdominal pain, and anemia.
The notes mention something called a lead line. What's that?
A lead line is a bluish-black line that can appear on the gums, a classic sign of lead poisoning. Another clue is basophilic stippling, which are small blue dots you can see inside red blood cells under a microscope.
Lead line, basophilic stippling. Those are helpful visuals to remember. What about treatment for lead poisoning?
We use chelating agents similar to arsenic poisoning. Succimer or EDTA are commonly used to remove lead from the body.
Let's move on to something a little less toxic. Rheumatoid arthritis. My notes say it's an autoimmune disease that attacks the joints.
That's right. In rheumatoid arthritis, the body's immune system goes haywire and attacks the lining of the joints, causing inflammation, pain, stiffness, and eventually joint damage.
So it's like friendly fire with the immune system turning on its own team?
A perfect analogy. The inflammation typically affects the small joints of the hands and feet first, and it's often symmetrical, meaning it affects both sides of the body.
The notes mention a rheumatoid factor. What's that all about?
Rheumatoid factor is an antibody that's found in the blood of many people with rheumatoid arthritis. It's not specific to rheumatoid arthritis, meaning you can have the antibody without having the disease, but it's a helpful clue in making the diagnosis.
Got it. So it's a marker, but not a guarantee. What about treatment? Is there a way to stop this immune system attack?
The goals of treatment are to reduce inflammation, relieve pain, and prevent joint damage. We use a variety of medications, including NSAIDs for pain and inflammation steroids for a more potent anti-inflammatory effect, and DMARDs, or disease-modifying anti-rheumatic drugs, which actually help slow down the progression of the disease.
Speaking of joint pain, gout is up next. My notes say it's caused by uric acid crystals?
Exactly. In gout, there's a buildup of uric acid in the blood. These uric acid crystals can deposit in the joints, causing sudden, intense pain and inflammation.
Ouch, that sounds excruciating. The big toe seems to be a favorite target, right?
It is. But gout can affect other joints as well. The notes also mention something called tophi. Are those related to gout? Yes. Tophi are deposits of uric acid crystals that can form under the skin around joints or even in organs like the kidneys. They're a sign of chronic gout and can cause damage over time.
So gout is all about too much uric acid. What's the treatment approach?
For acute gout attacks, the focus is on reducing inflammation and pain, often with NSAIDs or a medication called colchicine. Long-term management involves lowering uric acid levels with medications and lifestyle changes.
All right, moving on to bone health. The notes start with bone density and osteoporosis. What's the connection between these two?
Bone density is basically a measure of how much mineral content is packed into your bones. Think of it as the strength and solidity of your bones. Osteoporosis is a condition where bone density is low, making bones weak, brittle, and more prone to fractures.
So it's like having hollow bones.
Not exactly hollow, but definitely less dense and therefore weaker. Think of it like a honeycomb. The structure is there, but the walls are thin and fragile.
Okay, that makes sense.
Yeah.
What are the risk factors for osteoporosis? Is it just an age thing?
Age is definitely a factor,
So.
but it's not the only one. Being female, having a family history of osteoporosis, low calcium and vitamin D intake, smoking, excessive alcohol consumption, and certain medications can all increase your risk.
So it's a combination of genetics and lifestyle choices. What about treatment? Can you actually rebuild bone density?
We can definitely slow down bone loss and in some cases even increase bone density with medications like bisphosphonates.
Okay.
These medications help slow down the rate at which bone is broken down.
Got it.
And of course, adequate calcium and vitamin D intake is essential.
What about exercise? Does that play a role?
Absolutely. Weight-bearing exercise like walking, jogging, or dancing is crucial for maintaining bone health.
Right.
It puts stress on the bones, which stimulates them to become stronger.
Okay, back to inflammatory conditions. Ankylosing spondylitis is next on the list. This one sounds like it mainly affects the spine.
You're right. Ankylosing spondylitis is a type of arthritis that primarily affects the spine, causing inflammation, stiffness, and pain.
Okay.
Over time, it can lead to the vertebrae fusing together,
Oh, wow.
which can limit spinal mobility.
So it's like the spine slowly turning into one solid piece.
In severe cases, yes. That's why early diagnosis and treatment are so important.
Right.
The goal is to slow down the progression of the disease and maintain as much spinal flexibility as possible.
My notes also mention extra-articular manifestations for ankylosing spondylitis. Are those similar to what we saw with inflammatory bowel disease?
Yes, they can be.
Okay.
Ankylosing spondylitis can affect other parts of the body besides the spine.
Okay.
You might see eye inflammation like uveitis,
Okay.
heart problems like inflammation of the aorta,
Right.
and lung issues like restrictive lung disease.
Okay, so it's another one of those conditions that can have far-reaching effects.
Right.
What about Paget's disease of bone? This one seems to involve both breakdown and buildup of bone tissue.
Paget's disease is an interesting one.
Okay.
It's characterized by excessive bone breakdown and formation, but the new bone that's formed is often abnormal, weaker, and prone to fractures.
So it's like the bone remodeling process goes haywire.
Exactly. It can affect any bone in the body, but it commonly involves the skull, spine, pelvis, and legs.
My notes mention bone pain as a classic symptom. Is that the main way people present?
Bone pain is a common symptom, but some people have no symptoms at all and are diagnosed incidentally through x-rays or blood tests.
The notes also mention complications like hearing loss, headaches, and bone deformities. Those sound pretty serious.
They can be. The abnormal bone growth can put pressure on nerves, leading to hearing loss, headaches, or even spinal cord compression.
Wow.
Bone deformities like bowing of the legs or enlargement of the skull can also occur.
Okay, what about treatment? Can you slow down or reverse this runaway bone remodeling?
We can't cure Paget's disease,
Okay.
but we can manage it with medications like bisphosphonates.
Okay.
These medications help slow down bone breakdown,
Right.
which can help reduce pain and complications.
Okay, let's move on to another type of arthritis, osteoarthritis.
Yeah.
This one seems to be the most common type, often related to wear and tear.
Osteoarthritis is indeed the most common type, often called wear and tear arthritis, because it develops over time as the cartilage that cushions the joints breaks down.
So it's like the shock absorbers in our joints wearing out.
A perfect analogy. This leads to pain, stiffness, and limited range of motion, especially in weight-bearing joints like the knees, hips, and spine.
Okay, last one on the bone list. Osteomalacia. This one seems to be all about inadequate mineralization of bone, which sounds similar to osteoporosis.
They are similar in that they both involve weak bones,
Right.
but the underlying mechanisms are different.
Okay.
In osteomalacia, there's a problem with the process of mineralizing bone, often due to vitamin D deficiency.
So it's like the building blocks are there, but the cement that holds them together is missing.
Exactly. This leads to soft, weak bones that are prone to fractures and deformities.
Okay, what about treatment? Is it all about vitamin D supplements?
Vitamin D is crucial, but it's important to address the underlying cause of the deficiency.
Right.
Whether it's dietary malabsorption or lack of sunlight exposure, we need to figure out why the deficiency is happening and address that.
All right, let's shift gears again and delve into the world of hematology. Lots of blood-related conditions to cover.
Blood is a fascinating and complex system. It's like a bustling city with different cell types all working together. And when things go wrong, it can have wide-ranging effects throughout the body.
My notes start with polymyositis and dermatomyositis. These sound like they involve both muscles and skin.
You're on the right track. These are autoimmune diseases that cause inflammation of the muscles leading to weakness and pain.
Okay.
Dermatomyositis also involves the skin with characteristic rashes appearing on the face, eyelids, and nipples.
So polymyositis is muscle-focused, and dermatomyositis affects both muscles and skin. What causes these conditions?
The exact cause is unknown, but like many autoimmune diseases, it's thought to be a combination of genetic predisposition and environmental triggers.
Right.
Viral infections are a possible culprit, but more research is needed.
What about treatment? Is there a way to calm down the immune system attack?
Corticosteroids are the mainstay of treatment.
Okay.
They help reduce inflammation and suppress the immune response.
Got it.
Often, corticosteroids are combined with immunosuppressive drugs, which also help dampen the immune system.
Okay.
Physical therapy is also crucial to maintain muscle strength and function.
Okay, next on the list is pyogenic arthritis. Pyogenic sounds like buses involved. Yeah.
You're right. Pyogenic arthritis is an infection of the joint usually caused by bacteria.
Oh, no.
Staphylococcus aureus is a common culprit.
So it's like a septic joint.
Precisely. It often presents with sudden onset of pain, swelling, redness, and warmth in the affected joint. Fever and chills are common, indicating a systemic infection.
What are the common routes for this type of infection? How does it get into the joint?
It can occur through direct spread from a nearby infection like osteomyelitis,
Right.
which is an infection of the bone.
Okay.
Or it can spread through the bloodstream, especially in people with weakened immune systems.
Okay, so it's important to identify the source of the infection. What about reactive arthritis? This one sounds like it's triggered by something else.
Reactive arthritis, also known as Reiter syndrome, is a type of arthritis that develops in response to an infection elsewhere in the body.
Okay.
Typically, it's triggered by a sexually transmitted infection like chlamydia or a gastrointestinal infection like salmonella.
So it's like the immune system overreacts to the infection and attacks the joints in the process.
Exactly. The classic triad of symptoms is arthritis, urethritis, inflammation of the urethra, and conjunctivitis, inflammation of the conjunctiva, the membrane that lines the eyelids and covers the white part of the eye.
Okay, so it affects the joints, urinary tract, and eyes.
Oh.
What about treatment?
Treatment focuses on managing the symptoms, often with NSAIDs to reduce pain and inflammation. Sometimes corticosteroids are needed if the inflammation is severe. Treating the underlying infection is also crucial.
Okay, last one on the inflammatory conditions list. Still's disease. This one seems to primarily affect children.
Still's disease, also known as systemic onset juvenile idiopathic arthritis, is a type of arthritis that causes inflammation in multiple joints, along with fever and a distinctive salmon pink rash.
So it's like a multi-system inflammatory disorder specifically affecting children.
Exactly. It can affect various organs, including the heart, lungs, liver, and spleen. It can be quite challenging to manage, but thankfully, treatments have improved in recent years. That's a good way to put it. Early symptoms of hemochromatosis can be quite vague, like fatigue, joint pain, and abdominal discomfort. But as the iron overload progresses, it can lead to more serious problems like liver disease, heart failure, diabetes, and arthritis.
So early diagnosis is critical. What's the treatment approach?
The mainstay of treatment for hemochromatosis is phlebotomy.
Phlebotomy, isn't that just a fancy word for bloodletting?
It is. We're basically removing blood to reduce iron levels.
Yeah.
It's like donating blood, but with a therapeutic purpose.
Okay, next on the list is hairy cell leukemia. That sounds unusual.
Hairy cell leukemia is a rare type of cancer that affects B lymphocytes, a type of white blood cell. It gets its name from the hair-like projections on the surface of the leukemia cells.
So it's like the leukemia cells are wearing little fuzzy sweaters. What are the symptoms and how is it treated?
People with hairy cell leukemia often experience fatigue, an enlarged spleen, and low blood counts, which can lead to infections and bleeding. Fortunately, hairy cell leukemia is often very treatable with chemotherapy.
That's good to hear. Now let's move on to a medication that's commonly used to prevent blood clots. Warfarin. My notes say it's a vitamin K antagonist. What does that mean?
Warfarin works by interfering with the action of vitamin K, which is essential for the production of certain clotting factors. By blocking vitamin K, warfarin reduces the production of these clotting factors, making the blood less likely to clot.
So it's like sabotaging the clotting factory by cutting off its supply of vitamin K.
Exactly.
Clever. What are the common uses for warfarin?
Warfarin is used to prevent and treat blood clots in various conditions, including deep vein thrombosis, pulmonary embolism, atrial fibrillation, and heart valve replacement.
Okay, so it's a mainstay in preventing thromboembolic events. The notes also mention a test called the Coombs test. What's that used for?
The Coombs test is a blood test used to detect antibodies that are attached to red blood cells. It's helpful in diagnosing conditions where the immune system is attacking and destroying red blood cells, such as autoimmune hemolytic anemia.
Got it. So it's like a search and destroy mission for rogue antibodies. Okay, let's shift gears again and delve into some more lung-related conditions. My notes start with asthma.
Asthma. A very common condition, but it can be quite debilitating.
It is. Asthma is a chronic respiratory disease characterized by inflammation and narrowing of the airways, making it difficult to breathe.
Right.
So it's like trying to breathe through a straw.
That's a good analogy. People with asthma experience wheezing, coughing, chest tightness, and shortness of breath. These symptoms are often triggered by things like allergens, exercise, or cold air.
The notes mention a test called spirometry as a key diagnostic tool. What does that involve?
Spirometry is a simple breathing test that measures how much air you can inhale and exhale and how quickly you can exhale. It's used to assess lung function and diagnose conditions like asthma and COPD.
What about treatment for asthma? What are the mainstays?
The goal of asthma treatment is to control inflammation and prevent symptoms. We use inhaled corticosteroids as the cornerstone of treatment, along with bronchodilators, to quickly relieve symptoms during an asthma attack.
Okay, next on the lung list is cystic fibrosis. The notes describe it as a genetic disorder that affects multiple organs.
Cystic fibrosis is an inherited disorder that affects the cells that produce mucus sweat and digestive juices. It causes these fluids to become thick and sticky, leading to problems in the lungs, pancreas, and other organs.
So it's like the body's internal plumbing gets clogged up.
That's a good way to put it.
Yeah.
People with cystic fibrosis often experience recurrent lung infections, difficulty breathing, and problems with digestion and absorption of nutrients.
The notes mention a test called the sweat chloride test as a diagnostic tool. What does that involve?
The sweat chloride test measures the amount of chloride in sweat. People with cystic fibrosis have higher levels of chloride in their sweat due to the abnormal function of the sweat glands.
Okay, so it's a simple test with big diagnostic implications. What about treatment for cystic fibrosis? Is there a cure?
There's no cure for cystic fibrosis, but treatments have improved dramatically in recent years. We use a multi-pronged approach. Antibiotics to prevent and treat lung infections, airway clearance techniques to loosen mucus, and medications to improve lung function and digestion.
Okay, so it's about managing the symptoms and preventing complications. Let's move on to a condition that can be a medical emergency. Pneumothorax. The notes describe it as air in the pleural space.
Pneumothorax, also known as a collapsed lung, occurs when air leaks into the space between the lung and the chest wall, causing the lung to deflate.
So it's like someone let the air out of the tire.
That's a good analogy. This can happen spontaneously due to lung disease or as a result of trauma.
The notes mention a specific type called tension pneumothorax. What's that about?
Tension pneumothorax is a life-threatening condition where the air trapped in the pleural space puts pressure on the heart and lungs, preventing them from functioning properly. It's like a one-way valve. Air can get in, but can't get out, so the pressure keeps building.
Okay, that sounds like a critical situation. What's the treatment for pneumothorax?
The treatment depends on the size and cause of the air leak. Small pneumothoraces may resolve on their own, while larger ones often require a procedure to remove the air, either with a needle or a chest tube.
Okay, next up is bronchiectasis. The notes describe it as abnormal widening of the airways.
Bronchiectasis is a condition where the airways of the lungs become damaged and widened, leading to a buildup of mucus and recurrent infections.
That's like the airways become floppy and lose their ability to clear mucus effectively.
Yeah, precisely. This can be caused by various factors, including recurrent lung infections, cystic fibrosis, and immune deficiencies.
What about treatment for bronchiectasis?
The goal is to manage symptoms and prevent complications. We use antibiotics to treat infections, airway clearance techniques to help loosen mucus, and sometimes surgery to remove severely damaged portions of the lung.
Okay, let's move on to pleural effusion. What is that?
Pleural effusion is a buildup of fluid in the space between the lung and the chest wall.
So it's like a water balloon inside the chest.
That's a good analogy. It can be caused by a variety of conditions, including heart failure, pneumonia, cancer, and kidney disease.
The notes mention a procedure called thoracentesis to remove the fluid. What does that involve?
Thoracentesis is a procedure where a needle is inserted into the pleural space to drain the fluid. It's both diagnostic and therapeutic. We can analyze the fluid to figure out what's causing the effusion, and removing the fluid helps relieve symptoms like shortness of breath.
Got it. Let's move on to empyema. This one sounds pretty serious.
Empyema is a collection of pus in the pleural space, usually caused by a bacterial infection.
So it's like a supercharged pleural effusion.
Exactly. It's a complication of pneumonia, lung abscess, or other infections that spread to the pleural space. Empyema is a serious condition that requires prompt treatment with antibiotics and often drainage of the pus.
Okay, so it's not something to mess around with.
Yeah.
Next on the list is pulmonary tuberculosis. This one's a global health concern, right?
Tuberculosis, or TB, is a contagious bacterial infection that primarily affects the lungs. It's caused by a bacterium called Mycobacterium tuberculosis.
The notes mention a key diagnostic tool, the tuberculin skin test, or MAN2 test. What does that involve?
The MAN2 test involves injecting a small amount of tuberculin, a protein derived from the TB bacteria under the skin. If you've been exposed to TB, you'll develop a raised, hardened area at the injection site.
Okay, so it's like an allergy test for TB. What about treatment?
TB is treated with a combination of antibiotics, typically for several months. It's important to complete the full course of treatment to prevent antibiotic resistance and relapse.
Okay, let's talk about a condition that's becoming increasingly common. Pulmonary embolism, or PE. What is it, and why is it so dangerous?
A pulmonary embolism occurs when a blood clot, usually from the legs, travels to the lungs and blocks a pulmonary artery.
So it's like a blood clot roadblock in the lungs.
Precisely. This can cause sudden shortness of breath, chest pain, and even death if a large artery is blocked.
Okay, so early recognition and treatment are vital. What about treatment for PE?
Treatment typically involves anticoagulants medications that prevent blood clots from forming or growing. In some cases, thrombolytic medications which dissolve blood clots are used.
Okay, let's talk about a technology that's essential in critical care.
Yeah.
Mechanical ventilators. What are they and how do they work?
A mechanical ventilator is a machine that helps people breathe when they can't do it on their own. It delivers oxygen-rich air into the lungs and removes carbon dioxide.
So it's like an artificial lung.
That's a good way to think about it. Ventilators are used in a variety of situations, including during surgery and intensive care units, and for people with respiratory failure.
Okay, let's move on to a condition called tropical pulmonary eosinophilia. The notes mention eosinophils, a type of white blood cell.
Tropical pulmonary eosinophilia is a condition that causes inflammation and fluid buildup in the lungs. It's often triggered by parasitic infections, particularly filariasis. Eosinophils, a type of white blood cell involved in allergic reactions, and fighting parasites play a key role in this condition.
So it's like an allergic reaction happening in the lungs, but triggered by a parasite.
That's a good way to think about it. People with tropical pulmonary eosinophilia often experience coughing, wheezing, and shortness of breath, especially at night.
Okay, what's the treatment approach?
Treatment typically involves antiparasitic medications to eliminate the underlying infection.
Okay, let's move on to a condition called sarcoidosis. The notes describe it as a multi-system inflammatory disorder.
Sarcoidosis is a disease that causes small patches of inflammation called granulomas to form in various organs. The lungs, lymph nodes, skin, and eyes are most commonly affected.
So it's like inflammation on the move, setting up camp in different parts of the body?
A vivid analogy. The cause of sarcoidosis is unknown, but it's thought to be an immune response to an unknown trigger, possibly an environmental factor.
What about treatment?
Many people with sarcoidosis have mild symptoms and don't require treatment. Others may need medications like corticosteroids to suppress the inflammation.
Okay, let's move on to a test called exercise stress testing. What does that involve?
Exercise stress testing, also known as a treadmill test, involves monitoring your heart rate, blood pressure, and EKG while you exercise on a treadmill or stationary bike. It's used to assess how your heart responds to physical activity and diagnose conditions like coronary artery disease.
So it's like putting your heart through a workout to see how it performs.
Precisely. It's a safe and valuable test for evaluating heart health.
Okay, let's move on to a lung infection caused by a fungus. Allergic bronchopulmonary aspergillosis. That sounds pretty specific.
Allergic bronchopulmonary aspergillosis, or ABPA, is a condition that occurs in some people with asthma or cystic fibrosis who are allergic to aspergillus, a common type of mold.
So it's like a double whammy for people with asthma or cystic fibrosis.
Exactly. The mold triggers an allergic reaction in the lungs, causing inflammation, mucus buildup, and breathing difficulties.
Okay, what's the treatment approach for ABPA?
Treatment typically involves corticosteroids to control the inflammation and antifungal medications to target the aspergillus mold.
Okay, let's move on to a condition that can be frightening for parents. Croup. The notes describe a barking cough and difficulty breathing.
Croup is a common respiratory infection in young children. It causes inflammation and swelling of the airways, particularly the larynx and trachea.
So it's like a swollen throat that makes it hard to breathe.
Exactly. The classic symptom is a barking cough, often accompanied by stridor, a high-pitched whistling sound during inhalation. It can sound pretty scary, but most cases are mild and can be managed at home.
What's the treatment for croup?
Most cases of croup are mild and can be managed at home with cool, moist air and over-the-counter medications to reduce fever and discomfort. In severe cases, hospitalization may be needed for breathing treatments and steroids.
Okay, let's move on to a more common respiratory infection, acute bronchitis. The notes say it's usually caused by a virus.
Acute bronchitis is an inflammation of the bronchi, the large airways in the lungs. It's usually caused by a viral infection, and it often follows a cold or other upper respiratory infection.
So it's like the cold virus decides to take a trip down to the lungs.
That's a good way to put it. People with acute bronchitis often experience coughing, wheezing, chest discomfort, and fatigue.
What about treatment? Antibiotics, right?
Not necessarily. Since acute bronchitis is usually caused by a virus, antibiotics are not effective. Treatment focuses on relieving symptoms with rest fluids, over-the-counter cough medications, and sometimes bronchodilators to open up the airways.
Okay, so it's about riding it out and managing the symptoms. Next on the list is COPD, or chronic obstructive pulmonary disease. This one sounds pretty serious.
COPD is a chronic lung disease that makes it difficult to breathe. It's characterized by airflow obstruction that's not fully reversible.
So it's like the airways are permanently narrowed.
Exactly. The main causes of COPD are smoking and exposure to lung irritants like air pollution and dust.
The notes mention two main components of COPD, chronic bronchitis and emphysema. What are those?
Chronic bronchitis is characterized by a persistent cough with mucus production for at least 3 months in 2 consecutive years. Emphysema involves damage to the tiny air sacs in the lungs called alveoli, which reduces the surface area for gas exchange.
Okay, so chronic bronchitis is like a mucus overload, and emphysema is like having fewer and less efficient air sacs.
Exactly. Both contribute to the airflow obstruction. That's the hallmark of COPD.
What about treatment for COPD?
The goal of treatment is to slow the progression of the disease, relieve symptoms, and prevent complications. We use a combination of medications, including bronchodilators to open up the airways, inhaled corticosteroids to reduce inflammation, and sometimes supplemental oxygen.
Okay, let's move on to a condition that's often seen in miners and other workers exposed to dust. Pneumoconiosis. What's that all about?
Pneumoconiosis is a group of lung diseases caused by the inhalation of dust, usually mineral dust like silica coal dust or asbestos.
So it's like the lungs get clogged up with dust particles.
Exactly. This can lead to inflammation, scarring, and breathing difficulties.
The notes mention a specific type called silicosis. What's that about?
Silicosis is a type of pneumoconiosis caused by inhaling silica dust, which is found in sand rock and concrete. It's a serious condition that can lead to progressive lung damage and respiratory failure.
Okay, what about treatment for pneumoconiosis?
Unfortunately, there's no cure for pneumoconiosis. The main focus is on preventing further exposure to dust and managing symptoms with medications to relieve breathing difficulties and oxygen therapy if needed.
Okay, let's move on to a broad category of lung disorders. Interstitial lung disease. The notes describe it as a group of diseases that affect the interstitium, which sounds pretty vague.
You're right. Interstitial lung disease, or ILD, is a large group of disorders that affect the interstitium, which is the tissue and space around the air sacs in the lungs.
So it's like the scaffolding that holds the air sacs together gets damaged.
That's a good analogy. This can lead to scarring, stiffness, and difficulty breathing.
What are the common causes of ILD?
There are many potential causes, including autoimmune diseases, infections, environmental exposures, and certain medications. Sometimes the cause is unknown, which is called idiopathic pulmonary fibrosis.
Okay, so it's a diverse group of disorders with a variety of causes. What about treatment?
Treatment for ILD depends on the specific type and cause. Some types respond to medications like corticosteroids or immunosuppressants, while others may require oxygen therapy or even lung transplantation.
Okay, let's move on to a condition that affects the thyroid gland. Hyperthyroidism. The notes describe it as an overactive thyroid.
Hyperthyroidism occurs when the thyroid gland produces too much thyroid hormone. This leads to a sped-up metabolism. Think of it like the body's engine is revving too high.
So it's like the body is in overdrive.
Exactly. People with hyperthyroidism often experience weight loss despite increased appetite, rapid heartbeat, anxiety tremors, and heat intolerance.
Okay, what about treatment? Can you slow down the thyroid somehow?
Treatment for hyperthyroidism aims to reduce thyroid hormone production. This can be achieved through medications, radioactive iodine therapy, or surgery to remove part or all of the thyroid gland.
Okay, let's move on to the opposite condition. Hypothyroidism. The notes describe it as an underactive thyroid.
Hypothyroidism occurs when the thyroid gland doesn't produce enough thyroid hormone. This leads to a slowed down metabolism. Think of it like the body's engine is idling too low.
Okay, so it's like the body is stuck in slow motion.
Precisely. People with hypothyroidism often experience weight gain despite decreased appetite fatigue, cold intolerance, constipation, and dry skin.
What about treatment? Can you boost the thyroid somehow?
Treatment for hypothyroidism involves replacing the missing thyroid hormone with a synthetic version called levothyroxine.
Okay, let's talk about a condition that affects the adrenal glands. Cushing's syndrome. The notes describe it as an excess of cortisol.
Cushing syndrome occurs when there's prolonged exposure to high levels of cortisol, a hormone produced by the adrenal glands. It's like the body's stress response is stuck in overdrive.
Okay, so it's like the body is constantly on high alert.
Exactly. People with Cushing syndrome often develop a characteristic appearance with a round face, a hump on the back of the neck, and thinning arms and legs. They may also experience high blood pressure, diabetes, and weakened bones.
What about treatment? Can you lower cortisol levels?
The treatment for Cushing syndrome depends on the underlying cause. It may involve surgery to remove a tumor, medications to reduce cortisol production, or radiation therapy.
Okay, let's move on to a serious complication of diabetes. Diabetic ketoacidosis, or DKA. What is that all about?
DKA is a life-threatening complication of diabetes that occurs when there's a severe lack of insulin. Without insulin, the body can't use glucose for energy and starts breaking down fat for fuel instead. This produces ketones, which are acidic and can build up in the blood, leading to DKA.
So it's like the body's sugar management system goes haywire.
Exactly.
The notes mention symptoms like excessive thirst, frequent urination, nausea, and vomiting. Anything else we should look for?
People with DKA often have a fruity odor to their breath due to the ketones. They may also experience abdominal pain, rapid breathing, and confusion.
What about treatment for DKA?
DKA is a medical emergency that requires prompt treatment with intravenous fluids, insulin, and electrolyte replacement.
Okay, so recognizing those early signs is critical. Let's move on to a severe form of hypothyroidism. Myxedema coma. What is that?
Myxedema coma is a rare but life-threatening complication of severe hypothyroidism. It's characterized by decreased mental status, hypothermia, and other signs of organ dysfunction.
So it's like the body's systems are shutting down due to the lack of thyroid hormone.
Precisely. It's a medical emergency that requires prompt treatment with intravenous thyroid hormone replacement and supportive care.
Okay, next on the list are hyperlipidemias, which sound like they involve high levels of lipids in the blood.
Hyperlipidemias are disorders characterized by elevated levels of lipids such as cholesterol and triglycerides in the blood.
So it's like a fatty buildup in the bloodstream.
That's a good way to put it. Hyperlipidemias are major risk factors for cardiovascular diseases like atherosclerosis, heart attack, and stroke.
What about treatment? Is it all about diet and exercise?
Lifestyle modifications like diet and exercise are essential, but medications like statins, which lower cholesterol, are often needed to manage hyperlipidemias and reduce cardiovascular risks.
Okay, so it's a combination of lifestyle changes and medications. Let's move on to a condition that affects the pituitary gland. Diabetes insipidus, or DI. The notes describe it as a disorder of water balance.
Diabetes insipidus is a condition characterized by excessive thirst and urination due to a deficiency of antidiuretic hormone, or ADH.
So it's like the body's faucet is stuck on and it can't turn off the flow of urine.
That's a good analogy. ADH normally helps the kidneys conserve water, but in DI, there's not enough ADH, leading to the production of large volumes of dilute urine.
What about treatment for DI?
The treatment depends on the underlying cause. It may involve replacing ADH with a synthetic version called desmopressin, or treating the underlying condition that's causing the ADH deficiency.
Okay, let's move on to a condition that involves an excess of growth hormone. Acromegaly. What are the hallmarks of this condition?
Acromegaly is a hormonal disorder that develops when the pituitary gland produces too much growth hormone, usually due to a benign tumor. It typically begins in adulthood and causes gradual enlargement of the hands, feet, and facial features.
So it's like the body's growth spurt never ends.
That's a good way to think about it. Other symptoms include joint pain, headaches, and vision problems.
Okay, what about treatment? Can you shrink the tumor?
Treatment typically involves surgery to remove the tumor, followed by medications to control growth hormone levels if needed.
Okay, let's talk about a condition that's often associated with thyroid disorders. Pretibial myxedema. What in the world is that?
Pretibial myxedema is a rare skin condition that occurs in some people with Graves' disease, an autoimmune disorder that causes hyperthyroidism. It causes the skin on the shins to become thick, red, and lumpy.
So it's like a weird side effect of an already weird thyroid condition.
That's one way to look at it.
Okay, let's move on to a condition that involves the parathyroid glands. Hyperparathyroidism. What is that all about?
Hyperparathyroidism occurs when the parathyroid glands produce too much parathyroid hormone, or PTH. PTH regulates calcium levels in the blood, and when there's too much PTH, it can lead to high calcium levels, which can cause a variety of problems.
So it's like the body's calcium control system is out of whack.
Exactly.
The notes mention symptoms like kidney stones, bone pain, and weakness. Anything else we should look for?
People with hyperparathyroidism may also experience fatigue, constipation, depression, and cognitive problems.
Okay, so it can affect many different systems. What about treatment? Can you calm down those overactive parathyroid glands?
The treatment for hyperparathyroidism usually involves surgery to remove one or more of the parathyroid glands.
Okay, let's move on to a condition that affects women. Hirsutism. The notes describe it as excessive hair growth.
Hirsutism is a condition characterized by excessive hair growth in women, typically in a male pattern such as on the face, chest, and back.
So it's like unwanted facial hair gone wild.
It can be quite distressing for women. The underlying causes vary, but often involve hormonal imbalances such as polycystic ovary syndrome or PCOS or certain medications.
Okay, what about treatment? Is there a way to tame this excess hair growth?
The treatment for hirsutism depends on the underlying cause. It may involve medications to regulate hormones, hair removal techniques like laser therapy or electrolysis, or lifestyle modifications.
Okay, let's talk about a condition that affects electrolyte balance. Hypokalemia. What is that?
Hypokalemia means low potassium levels in the blood. Potassium is an essential mineral that plays a vital role in nerve and muscle function, as well as maintaining fluid balance.
So it's like the body's potassium stores are running low.
Exactly.
The notes mention symptoms like muscle weakness, cramps, and fatigue.
Yeah.
Anything else we should look for?
Severe hypokalemia can lead to more serious problems like cardiac arrhythmias, paralysis, and even respiratory failure.
Okay, so it's not something to take lightly. What about treatment? Is it all about eating more bananas?
Yeah. While bananas are a good source of potassium, the treatment for hypokalemia often involves potassium supplements, either oral or intravenous, depending on the severity. It's also crucial to identify and address the underlying cause of the potassium deficiency.
Okay, let's move on to the opposite condition. Hyperkalemia. What does that involve?
Hyperkalemia means high potassium levels in the blood.
So it's like the body's potassium levels are overflowing.
A good analogy, hyperkalemia can be dangerous because it can interfere with heart function.
The notes mention EKG changes as a sign of hyperkalemia. What do those look like?
Hyperkalemia can cause characteristic EKG changes such as peaked T waves, widened QRS complexes, and even sine wave patterns, which can be a sign of impending cardiac arrest.
Okay, that sounds serious. What about treatment? Can you flush out the excess potassium somehow?
The treatment for hyperkalemia depends on the severity. In mild cases, dietary restrictions and medications to increase potassium excretion may be sufficient. In severe cases, emergency measures like intravenous calcium insulin and glucose or dialysis may be needed to quickly lower potassium levels.
Okay, so recognizing those EKG changes is crucial. Let's talk about another electrolyte imbalance, hypercalcemia. What does that involve?
Hypercalcemia means high calcium levels in the blood. Calcium plays a vital role in many bodily functions, but too much calcium can be harmful.
So it's like the body's calcium control system is stuck on high.
Exactly.
The notes mention symptoms like fatigue, constipation, and bone pain. Anything else we should look for?
People with hypercalcemia may also experience nausea, vomiting, confusion, and kidney stones. Severe hypercalcemia can lead to coma and cardiac arrhythmias.
What about treatment? Can you dial down the calcium levels?
The treatment for hypercalcemia depends on the underlying cause and severity. It may involve intravenous fluids medications to reduce calcium levels or treatment of the underlying condition that's causing the hypercalcemia.
Okay, let's move on to a medication that's commonly used to treat bipolar disorder.
Lithium. Lithium is a mood stabilizer that's very effective in treating bipolar disorder, but it requires careful monitoring because it can have side effects, including kidney problems.
So it's a powerful medication that requires a delicate balance.
Exactly. It's important to monitor lithium levels regularly and adjust the dosage as needed to minimize the risk of side effects.
The notes mention genetic counseling as an important aspect of managing certain kidney diseases. Why is that?
Many kidney diseases, like polycystic kidney disease and Alport syndrome, have a genetic component. Genetic counseling can help individuals and families understand the inheritance patterns, the risks of passing on the disease to their children, and the available testing and treatment options.
So it's about empowering people with knowledge so they can make informed decisions.
Exactly. Genetic counseling can be a valuable resource for families facing kidney diseases with a genetic link.
Wow, we've covered a lot of ground in this deep dive. From gastrointestinal disorders to kidney diseases, blood cancers to electrolyte imbalances, we've explored a wide range of medical conditions and their treatments. Hopefully you feel much more prepared for that upcoming meditative exam.
Absolutely. Remember, the key is to focus on understanding the underlying mechanisms of disease and connecting the dots between symptoms, diagnoses, and treatments.
And don't forget those helpful visuals and analogies. Sometimes a little creativity can go a long way in making those complex medical concepts more memorable.
Exactly.
So go forth and conquer that exam. We're rooting for you.
Good luck.
And remember, the learning never stops. The world of medicine is constantly evolving, so stay curious, keep asking questions, and never stop learning.
That's right.